Hi everyone, my name is Fatima Barrett and this is my speech, Mental Health Institutions for Better or for Worse. Did you know psychiatric patients are often unclear about the length of their hospital stay? It is standard policy that there is a 3-day mandatory stay, but sometimes 3 days can turn into a week can turn into 2 days, 2 weeks, and 2 weeks have turned into a whole month. Imagine being held for 1 month in a place where lack of privacy is permitted, unnecessary medication is mandated, and every aspect of your life is controlled without your consent. Mental health institutions are debilitating, and change needs to be brought to their systems. I have been Baker-acted and admitted into Memorial's Hospital Psychiatric Ward to carry out my involuntary 3-day stay. Being Baker-acted was a traumatic experience for me. My middle school principal called the authorities on me to my house after I expressed thoughts of suicide. I opened my front door to find police standing there, and they were very serious and their expressions unsettled me a bit. I was fearful and I felt confused. I had no idea why they were there until they told me what my principal had told them. They questioned me about my suicidal thoughts and I answered them honestly. Then they told me to put my hands behind my back. I complied. They handcuffed me and they drove me to the hospital. At the time, I became distressed because I was thinking that I was going to jail for expressing my suicidal thoughts, until I figured out where they were taking me. The situation became worse, where I realized how dismissive the cops were and the staff were towards me, and I immediately felt uncomfortable. The lady told me that I am only allowed to wear certain clothing that has no strings, clothing that's would be considered too constricting to avoid, choking myself or anything. I wasn't allowed to have my phone. The door must always be open, at all times, 24/7. And I had to abide by the schedule they gave me. We were on a strict schedule, okay, we have to wake up 6 a.m., get our vitals done. Then at 8 a.m., we get breakfast. And then the rest of the time, up until lunchtime, which was probably at 1 or 2 p.m., we were just in, whether it be group therapy, or it could be individual therapy with the psychiatrist that was there. And during that time of my stay, I struggled to sleep a lot. And specifically that first night, when I finally was able to fall asleep, I was woken up by the pinching sensation of having my blood drawn. My body felt violated because they didn't even ask me if I wanted my blood to be drawn. They just went and just did it without my permission. Later that day, they made all of us do group therapy and individual therapy. And I would lie to the therapists about how I felt so that I was able to get out of there quicker. Every time my mom came to visit me, I would feel glad that she would visit me, but I would also beg her to find a way to get me back home because I really, really hated being there. Everything on the schedule, I did my best to comply to avoid certain privileges being taken away. So if I didn't do this, say okay, if I didn't do like individual therapy, or like if I didn't like well behave, then they would like take my outside privileges out, because we were allowed to go outside once a day, and if I didn't do good that day, they wouldn't allow me to go outside. So it was practically like they were like taking my rights away. Once I finally came out, I began bottling up my feelings as a trauma response, because I learned that if I shared too much of what I was feeling, I might go back there again. And that place, I did not want to go back there, because I felt like my rights were stripped away from me the moment I walked in. From the research I have conducted, news reports have called attention to patient harm in inpatient psychiatric settings, including issues of abuse, negligence, understaffing, sexual assault, inappropriate medication use, patient self-harm, poor sanitation, and inappropriate restraint and seclusion. These experiences have left people feeling just as depressed, if not more depressed, than before admissions. One person stated, "The first thing I learned as soon as I was put into the hospital was that I couldn't actually talk about what was wrong, because then I would be taken against my will somewhere, and my parents would have to pay for it." Distrust and unwillingness to disclose suicidal thoughts were reported amongst people who used outpatient mental health services. Another person shared, "I definitely didn't ever want to get involuntarily hospitalized again. If I ever get to a point where I was suicidal again, I think I would be too scared to even get help, because the whole experience terrified me." To conclude, no one should ever be afraid to speak up about what they're feeling, about their internal struggles, even if they are struggling with thoughts of suicide. It should be up to the person if they want to get help and what kind of help they want to receive. Even if a person does or does not commit themselves into a mental institution or a psychiatric hospital, all patients should be treated fairly, with kindness and respect, not like prisoners. Many people have used their social media platforms to speak of their own experiences in psychiatric settings and injustices they faced while they were there, to provoke others to speak up and bring change to the psychiatric care system. If anyone who is watching this video has been through similar experiences in the psychiatric setting, whether it was in the psychiatric hospital or a mental institution, please, I beg you to speak up. I beg you, I encourage you to speak up, and know that you are not alone. Help bring an end to this unjust system, and help mentally ill people. Help anyone get the proper help that they deserve. My sources are investigating the impact of involuntary psychiatric hospitalization on youth and young adult trust and help seeking and pathways to care by the NIH, and patient safety in inpatient psychiatry, a remaining frontier for health policy in the NIH. Thank you for listening to my speech.